Yeah, so I'm confused right now because I've been reading different things. Is it don't expect things to start opening up in weeks, it'll be months, or is it don't expect things to start opening up in months, it'll be weeks? Because I feel like I've heard both come out of Newsom, and it probably just because I'm not really paying attention.
I think he says weeks, not months, as long as we stay on tack, as long as we keep doing what we're doing and don't go out and touch everyone's nostrils.
Right. Well, what he doesn't want people to do is go like have beach days on the weekends, right? Like that. He's about to shut that down, right?
Let's stop going to the beach where everyone is just like drinking and screaming and they're just like juggling each other's respiratory droplets on the beach. And then they go home and they pick their noses and everyone has the COVID.
Yeah, that he laid that out pretty much in that same kind of detail.
I think that was verbatim. Yeah,
I think that was it.
Did you see that there's like two very, very different opposing demonstrations set to take place tomorrow at the Capitol? So it'll be today if you're listening, the day that we publish.
I'm only aware of the now weekly Chud demonstration. Is there another one?
The Chuds.
So,
the Flu Klux Klan.
I know nothing about any of this.
Wait, yeah.
The Flu Klux Klan, yes.
The Flu Klux Klan that's what we're calling the reopen protesters who the right-wingers who fled the Capitol, and they're supposed to stay in their cars. They apparently have told CHP again that they will be staying in their cars. If anybody wants to take me on this, I put $5 on they will not stay in their cars. That's where my money is going.
Having been there at the last one, I'm not going to take you on that bet. But they,
which is a weird way to say "fuck the police," right?
Right.
Like,
but
there's this weird approach to them, right? Where I'm just like, what? Whose side are you? Like, ideologically, why are we all here?
A little context for people, the Reopen California folks, it's a group of 100,000 or so on Facebook, and they set up these rallies to reopen California every week or so in different cities throughout the state. And they're all sort of like MAGA Trump supporters. There's a strong thread of racism in there. There's also a strong thread of anti-vaxxers. So it brings together all of these folks into the same space. Alongside that, there is set to be a demonstration. Let me check. I just got a press release on this. An immigrant rights group is going to the Capitol in a car rally.
Oh shit!
Around, I suppose it will be. Nope. It basically begins at the same time as the last Flu Klux Klan rally. So
this is going to be a wild fucking time.
That's rich.
Should be interesting.
Cool. What time is that so that we can stay the fuck away from the Capitol?
Well, the immigrants' rights one is, I believe, a little afternoon. And I think the Flu Klux Klan, I didn't look into this one, but this was happening at that time last time they held this demonstration.
Yeah, so. It started at noon last time.
Yeah.
No.
So, yeah, usually we joke about stuff in the intro, but this is just our reality right now. And
what's the joke?
Yeah. And they'll be here. We'll have the helicopters back. We'll have people screaming, and
it'll be great. Thanks, guys.
You see the tenor kind of changing a little bit. You saw what happened in Michigan today being Thursday with
which, as far as I can see, the articles that I read did not describe it as so, but it was basically like redneck terrorists show up with guns to the state building and demand that the state do what they want.
These are like Oklahoma City type guys, right? These are the somewhat Waco oriented. They are, kind of the backwoods. Where was that in Oregon? Like the folks that hunkered down and said we're going to be a sovereign.
Oh yeah, what was that
Basically, these
dude's
type of
name?
folks. I'm glad I don't remember it.
Yeah, honestly, I'm pretty okay with not remembering it too. But now it is going to bug me. By the end of this episode, I'm going to remember that dude's name.
Okay.
When Skylar just shouts a name, let's all remember that's what we're talking about.
And it'll be something like Buford or something, and we'll
It's
all
not
get it.
Buford. I would know if it was
Yeah,
Buford.
that guy.
Let it be Buford.
Beauregard or yeah.
It's probably Beauregard. That sounds right.
It has to be a Confederate name. Come on.
Yeah.
Right. It's,
All right. Well, on that note,
yeah, dude, there were some laughs. We got some laughs in there.
sure.
there's something.
Now that we're
That's
all
helpful for context. This is what lighthearted banter means.
yeah. Well, now that we're all having a nice uproarious laugh, let's start the damn show.
Let's do it.
Voices, the things they said. Voices, some from those dead. All the voices heard. Voices, things we say. Voices, they're in your head. All the voices heard.
Hello, everyone. You've got Kempa.
And Skylar.
And Shannon.
And Flo.
Hello.
All right.
The gang is all here. And we have a very special guest tonight, or today, in Kim Lau, who I believe is the founder of the Encampment Med Team. How are you, Kim?
Yep. Hey, thanks for having me on.
Yeah, absolutely. So I guess, first of all, let's give people some context of who you are and what it is you're doing and what it's all about. The Encampment Med Team started just last month in March when all of this was starting, the pandemic here in the Sacramento region. Can you tell us, well, first tell us kind of who you are, what you do, your background, and then get into what the Encampment Med Team is and what it is you're doing with it.
Yeah, sure. So my name is Kim Lau. I'm currently a first-year medical student at California North State. And a bit about me is that I was really involved in LGBTQ community organizing before coming back to Sacramento, even though I grew up in this area. And I've been kind of involved with the Homeless Youth Task Force in Sacramento for the past year. And that's kind of my connection to the homeless community in Sacramento. When this all kind of started happening, I reached out to several of the people that I'm on the task force with and kind of asked if there's a group that I could maybe volunteer with, like a healthcare unit. And the response was basically, why don't you just come out and take a look for yourself? And so I did and found out there was no healthcare unit. In fact, there was no healthcare services whatsoever. Yeah. And they were kind of like, would you like to be the healthcare unit? And so I guess I got together a whole bunch of other medical students, mostly my classmates. I also shot off some emails to UC Davis. And we were originally just planning to do healthcare education. But as the need has expanded and as we've gotten connected to more people, that's really evolved into doing COVID screenings, working with the county public health department, working with Metro Fire and their mobile integrated health units, doing low acuity care, and doing a lot of needs assessment for public health. And I think that's actually
explain what low acuity care is. I'm sorry.
Yeah, sure. Basically anything that you don't need to take to the ED and that you could do with like wound care or over-the-counter medications. So like an abscess or like a dog bite, things like that.
Wow. So how large has this team gotten to be since you started in mid-March, 6 weeks ago? Yeah,
well, we're roughly 28 people on the ground, and then we have about 10 people supporting us in different logistics capacities. And we have 3 of those 28 people, which I'm really glad about, are not medical students. So we have a PA student, a nursing student, and a master's student. So
that's really cool. Now, to me, this, and correct me if I'm wrong, but this strikes me like not just as a like filling a need, right? It also strikes me as kind of a radical thing that you're doing. And you know, when I look at something like a Loaves and Fishes, that it was started by sort of Catholic anarchists that were just frustrated by a society that wasn't taking care of people. Do you think that there's something to that spirit in what it is you're doing and why you started this?
I mean, I guess to be fair, I think all grassroots needs filling are radical to some extent. Just because our systems are often built in ways that are just vastly inefficient, and don't actually start from where the communities are that have the needs. And so if you start from asking people, what do you need and what would you like and how would you like to have shared decision making in this, that's inherently radical, in which even though I don't think that necessarily deserves that title.
Right. Now, when you're going out and serving these folks, what strikes you the most about you know, this process, meeting people who have these needs that probably haven't been met for a fairly long time?
I guess I would say two things, and they're kind of on different ends of the spectrum. I would say one of them is that unhoused folks have incredible amounts of, and this probably shouldn't come as a surprise, but I think I'll just reinforce it, just have incredible amounts of agency and leadership and creativity, resourcefulness in finding and meeting their own needs. And so they're usually the ones who know much better than us what would work best, what tools would assist the things that they're already doing. So one of the things that we came in with the first time was, oh, there are some CDC recommendations. How do you think your camp can work to meet these? And people were like, hey, we already are working on like building latrines. We're trying to do hand washing stations, but there isn't consistent water. So if you could figure out a way for it to be consistent, or for the police just not taking them away, that'd be great. So if you could just not detract from our own efforts, that would be great. And people were already talking about how they were social distancing. One camp had already set up an isolation tent themselves without our prompting. And so we were like, what are you going to do when someone gets sick? That's the isolation tent. These are the people who are assigned to take care of that tent. Here are the people who were former healthcare workers and know how to do this better than these like brand new upstart medical students. So we've mostly been kind of like identifying, assisting, and just kind of lending credence, I don't know how to pronounce that, to things that are already being done. Yeah. And I guess the second thing is that I realize this is a pandemic, and that's it's part of the nature of an emergency response. But I think in general, there's been a lack of urgency in a lot of the health systems and government systems that are supposed to be identifying the most vulnerable. And just kind of seeing the inefficiency of those systems has been very sobering.
Yeah. We've talked about that a bit. And Shannon, I think you could probably flesh that problem out a bit too, being sort of a frontline social worker for folks who often have serious needs. For the first, how long during all this, 5 weeks, we saw no movement in Sac County providing any unhoused person with the shelter that Governor Newsom had promised. Can you speak to that a little bit, and then any sort of updates, Shannon?
Yeah, so in terms of folks accessing those services that were made available for people experiencing homelessness, did I freeze? No.
Just briefly.
Yeah.
Oh, okay. Cool. I'm back.
You're back.
Yeah, and she's done again.
Oh, shit. I'm on the wrong internet. Okay, hold on. Pause.
All right, hang on. Where are we at here?
Yeah, you're gonna have that screen of like technical difficulties.
Oh my gosh. Why won't I come back?
There you are.
Hey.
Hello, I'm back.
That was easy. Oh.
I had to switch networks. So I need to post it on my computer that says switch internet.
Do you remember my question? Because I don't.
I do remember your question. So, in terms of those trailers and motels that were made available for people experiencing homelessness during the pandemic, that was all discussed at the city and county level in late March. That was not rolled out. Like there were no folks actually put into those units until April 8th. So what we're seeing, like the updated numbers, or let's talk about like the whole picture. Right now, there are 2 motels that are considered preventative quarantine care centers that are available, and the number of rooms are 263 rooms. So as of right now, or as of the 23rd, sorry, this report was released on the 24th. So as of the 23rd, the number of households or individuals served in those trailers are 1 in the week between the 18th and 23rd.
Wow.
In total, 3. And then in total, we've had 100 households and 125 individuals served. So in total, between the trailers and the motels, we have seen 103 households and 128 individuals served. So as a reminder to our listeners, the point in time count, which is something that is federally mandated for communities receiving HUD funding, it happens every other year in the odd year. On the same night, in the middle of the night, volunteers go out to count people.
On a Tuesday night in late January.
In the chill of January, we found that just over 5,300 people were experiencing homelessness on that night. So we know that based
just
on
also
the method.
For the listeners, that count is likely very low too. That's who they were able to find and count.
Correct. Yeah. So we know that
homeless youth, single women with kids, it behooves them to not be seen at night, and so they're very good at that, and they likely are undercounted among other populations.
Right. The other thing about, if we're talking about our local government's response to this pandemic, is that Kim brings up the point that running water is something that does not exist in many of these encampments. And so since April 8th, the total number of hand washing stations that have been made available to folks are 48, and along with 40 toilets, and those things exist in 30 locations. Now, it's unclear to me whether or not those 30 locations are, like, for example, 7 hand washing stations in Cesar Chavez Park. and so that's 7 locations? Or are we saying that there's X amount of hand washing stations in Cesar Chavez Park? Those 7 equal 1 location.
Right.
We don't know that. That information has not been made available to us. The other thing to know about what's going on out there is that the city and the county, and this is like the thing that fucks me up, they have designated 37 outreach navigators to reach people experiencing homelessness during this pandemic. 37 people. That's it. They've identified 40 encampments with 20 or more individuals and 37 encampments with less than 20 individuals. The total number of encampments identified is 77. Those encampments are identified by the 37 people. If they actually had a team of people out looking for those encampments, can you imagine the number of encampments they would find?
Right. Well, this is something that it's striking that, Newsom has done pretty good on a number of things in response to the coronavirus, but this topic in particular, homelessness, has been completely pushed to the side. And it's been just fucking maddening to watch our most vulnerable communities not get what like they deserve as human beings, but not get what they were promised by this governor.
Yeah, and so what we're finding outside with out at Loaves is there's a lot of people who will show up and they're like maybe they haven't shown up in a number of weeks because they understand what's going on, and so they are, as Kim mentioned before, folks outside they know what's up, right? And they're smart people and they're resourceful, and so they know to stay away. So we have people showing up in the last couple of weeks where they're like, hey, where are those outreach workers that were going to put me into motels? Like,
Right.
No one has come out to talk to us. So, and the county, the COVID response team is reporting that the encampment locations throughout Sacramento County have been surveyed except for 3 areas. And I just can't believe that's true. Because we're hearing way too often from people outside that they've not seen anyone, or that they're seeing people from, Kim's team, but they're not seeing the outreach navigators who are coming out to ask them whether or not they need to assess them for those motels. The one thing, and this is because I'm remembering Skylar's thing, which is credit where credit's due, is that just I don't fucking know time anymore or days. So I don't know if it was last week or early this week. But so there were tiers or not tiers, motherfuck, I can't.
It was like a triage.
Prioritizations. Thank you. There was a prioritization schedule for who was going to get access to those motel rooms and to those trailers, and it was absolutely bananas. And as of whenever the fuck time it was, last week or early this week, that has been wiped, and they're putting folks 55 plus. So they're assessing people who are 55 plus to get into those spaces. The downside, or the frustrating part of that, is that they do have to be a part of the HMIS, which is Homeless Management Information System.
Right. It's the funnel you go in to get into housing eventually.
Right. It's what they like to think, it's like central intake, right? Where we put everybody's information so that anyone who has access to this database can see where people have accessed services. So if you're not in the HMIS system already, you have to go through that whole process. And then also complete the VI SPDAT, which is a vulnerability index, and it gives you a number The higher the number, the more vulnerabilities you have. So this process to be assessed to get into those motels is still pretty lengthy.
And HMIS is maddening because, you know, you interact with the county one day, who knows the next time you're going to interact with the county, if you'll be able to get a hold of them, if they'll be able to get a hold of you, because, you know, you're in crisis mode, you've got a life that you're living.
Right. And that's it. Something that we are seeing is that people will come in, they'll do the assessment, and then like maybe they don't get taken that day, but the outreach worker is like, I'll be back tomorrow. The outreach worker comes back tomorrow and they're not around, right? Like, because they've figured something else out, because they're tired, because, you know, whatever. The other thing that I feel like is really worth mentioning is that in the community of people experiencing homelessness, Sacramento Steps Forward is not trusted. There's a lot of people who are not down with the agency because they have been burned by navigators in the past. So navigators come out and they say, yo, you want to get into this motel? And they're like, the fuck I do? Like, nope, not if you're the one doing it. So there is a trust issue. And something that I have always said is that we're always talking about, like, we tell the message is like, we're helping, you know, you should take this help that we're giving you, but we really have to earn the trust of people experiencing homelessness. Like, we can't, if someone were to just drive up to your house today and say, get on this bus, I'm going to take you to this hella tight mansion, and you're going to, like, you know, I'm trying to like make it attractive in the way that like they make a hotel attractive to feel like, if you can have a hot tub and mimosas, like, would you get on the bus? You'd probably have
be
some
like,
questions.
I don't believe you have, yeah, right.
You know, and all of us, and that is something that they just like don't have any room for. Like, you're gonna get on this fucking bus and you're not gonna take any of your shit with you. You're just gonna get on the bus and you're gonna get in this motel. And they're like, well, I'm gonna do my life the way that I've been doing it.
There's a serious level of rapport building that's necessary, and once you've been you know, promised a path to housing and it falls, if the bottom falls out 2 or 3 times, you start saying, no, I don't want this anymore.
Yeah, totally. I just got so angry that I fogged up my glasses. Take them off.
Well, can we
sweating?
Can we get back to our guest?
Yes,
so fair.
Kim, I mean, what, as far as, and I mean, your main priority is providing services for folks. So what, can you just paint a picture for us, like how often you are out there and what that looks like on a day-to-day basis? By the way, listeners, she was like taking finals and finishing her second semester of med school while starting all this.
Yeah.
Wow.
Do not recommend. It looks different for every site, and that's my team has been incredibly adaptable. But basically, there are anywhere from 2 to 4 people per team, and we try to keep that team restricted to a geographic area because we are potentially sources of transmission, especially since a lot of us are on clinical rotations. Each team will visit their area anywhere between once a week or 3 times a week, just depending on capacity. We usually start the visit by kind of checking in with people we know, especially people who are oftentimes leaders in the encampments, and just letting them know that we're there, we're around, and it's for everyone's safety. And then we ask a lot of questions about things like about needs assessments. So, have there been any police sweeps, any disruptions? Have you noticed anyone with respiratory symptoms? Has your access to clean water or a restroom changed recently? And then we'll go around and just literally check up on people and see if there are kind of other symptoms as well as COVID. So in my camp, we've seen a lot of abscesses, and we're also seeing a lot of chronic illnesses that just aren't able to receive like regular healthcare. And that's been a really huge problem because we really can't do primary care services. And so something that I'm working on right now is trying to get us health navigator training. So being able to register people for Medi-Cal and get people connected to PCP. It's a lot of services that we really didn't plan on providing. And like, we didn't plan on building hand washing stations. But we've kind of umbrellaed that as, you know, as Shannon was saying, housing just isn't a feasible solution for the point in care. The point in time count says there's about over 5,000. Crystal Sanchez from the Homelessness Union says there's over 11,000, and I'm inclined to trust her numbers. So there's just no way we're going to be able to house or effectively treat 11,000 people. And so we're going to have to think kind of more creatively about how to empower people to use their own tools. And so whether that be hand washing stations, isolation tents, teaching people how to do wound care themselves. We've kind of just been ground teams and making up solutions as we go along.
I can keep going with questions. I just want to see if anybody else has one.
Nah, keep it going.
All right. So it's really interesting to me that this has turned from, you know, the initial concern I think that all of us were having back in March was, oh my God, this pandemic, this highly vulnerable population that already has, you know, potential, you know, folks with COPD or, you know, asthma or whatever, like, you know, issues that would, were they to contract it, could be potentially fatal. This community needs to be protected immediately. Your team has gone out there to provide these services. You said you're providing tests. Can you tell me, like it sounds like you're providing just like care, immediate care for them that they've needed for a while, which is amazing. On the front of, you know, the sort of COVID-19 front, how many tests are you giving out on a given week? And have we seen any positives? Are we seeing any symptomatic folks, anything like that out there?
So we're not exactly giving tests. What we're doing is we're working with the MIH unit who actually does and administers the tests. And so we kind of we screen people, then we identify these 3 people look symptomatic, and then we coordinate the MIH unit, and we're usually on site when they come so that we can actually find the person and give them the test. And then when the result comes back, we're the ones who give the result. But testing has been incredibly limited. Honestly, that has not been anyone's fault. The public health department has been working, the lab there has been working incredibly hard to supply everyone with tests. But just because everyone is trying to use COVID tests and they're standardized to use specific media and specific swabs, those are just completely sold out everywhere. And there's very low probability that we can get more.
Right.
So I was speaking to Dr. Gonzalez, who's the lab director, recently, and he said they're attempting to assess if they can use alternate media, which is just the solution the test is in that preserves it, and alternate swabs, but yet to hear back on that. So that's been kind of a not great situation.
Yeah, same sort of hurdle that everyone's experiencing that right now.
Yeah.
And
the thing, honestly, that we're most worried about is the more we're seeing on research for COVID is that there's a lot of asymptomatic patients. There was a recent study on people experiencing homelessness in Boston, and they tested 400 people, and about 100 of them who were positive were asymptomatic.
Wow.
And asymptomatic people are carriers and could really easily spread the disease, especially since, as you were saying, a lot of unhoused folks have pre-existing conditions. So it's kind of a very risky situation. We're really trying to get enough testing to be able to test asymptomatic people.
So it sounds like you're saying, having more tests would be very helpful. What are some things, what are perhaps other needs that your regular member of the Sacramento community could do to help you do the work that you're doing right now?
I think there are a couple. So I think the biggest thing is just making sure that the government does what it has said it would do. There's a coalition called Services Not Sweeps, and they are doing really important work trying to get the sweeps to stop, because sweeping just disrupts everything and increases the risk of transmission. It's also just inhumane.
The CDC says don't do it.
Yes.
Right.
And we can't even find people afterwards. And so if I tested someone for COVID, came back the next day, they were swept. If it was a positive test, it's just like,
you can't let them know now. Yeah. And there's no protocol. And that's been a maddening one to try and explain to city and county officials. But so I'm sorry for interrupting. How community members could help would be to join this coalition to reach out to their electeds?
Yeah, I think so. I think amplifying the message of the coalition would be really solid, and probably for me, item number 1. 2, I just want to shout out some of the really great orgs that are doing work. I know Loaves and Fishes is constantly on everyone's names, so really appreciate that. St. John's has been offering showers 7 days a week, which is just incredible. SAC Soup has been doing an incredible amount of feeding programs.
SAC Soup is brand new,
Yes.
but they've been able to procure funding and volunteers to get a lot of meals into a lot of people's hands. So that's been cool to see.
Yeah, and they've been especially spearheaded by the SAC Homeless Union, which really is the one that's kind of facilitating the trust between and rapport between us, SAC Soup, all the new people working on this, and people who are experiencing homelessness.
Oh, that's an interesting point. The trust by proxy, which is necessary. Yeah.
Huge.
And Kim, I'm curious, in addition to being able to join the coalition and do some work in this way, what is your sense of need in terms of donations of things, masks, sanitation supplies? How are you all on those supplies, and is that something that community members can contribute in some way?
Yeah, well, I could tell you what my team needs. My team desperately needs thermometers and pulse oximeters. We have been just really short on them, so we're actually literally passing them off between each other at the moment. So driving across the county and just trying to get pulse oxes from one team to the other.
So for a layman like me, what is a pulse oximeter?
It's just like a little, it looks like about this big, and it measures how much oxygen you have in your blood. And so if you're below 94%, that's kind of concerning. And a pretty good early sign.
Indicator, right.
Yeah. And sometimes people can look pretty asymptomatic, but then have kind of a low O2 sat. And so that's actually a really good thing to watch out for.
Okay.
We're also looking for hand sanitizer. We could use mask donations because we are giving masks to the people we're serving. So that would be really useful. Also a lot of wound care. So gauze is in a lot of need. Iodine swabs, because they're much less painful than alcohol swabs. And antibiotics. So if you have triple Bactrim, antibiotics. They just come in these little packets or like tubes, which you just coat on, kind of like Neosporin, which would also work. That would just be really, really valuable.
Do you have like a list of material needs, like on your website?
We haven't put it up yet, but I'm hoping to get it up by Monday, I think is the time. Yeah.
Well, I'll make a list of all of this too, and we'll put it in our show notes.
How do we get, if we have people who want to get these items to you, how do we reach out?
Right now we have a comment box. It's not the most efficient way to do it. When we put that list up, there'll be a phone number you can call, and then one of our team members will just do a drive-by pickup. Yeah.
Okay.
But yeah, we've been operating out of my garage right now, so it's kind of
Are you really?
I wonder what my neighbors think, honestly. We have like 20 people coming in and out carrying boxes, and it's a pretty funny looking operation.
And
I think let folks know what specific stuff you need as well, like not just thermometer, but like we want these ones because, you know, folks are going to try to get things for you and want them to be as useful as possible.
That's
totally
true. Temporal scan, infrared.
Yeah, because somebody's going to go like, oh, the one I see in the Target baby section, that one.
Right.
It's like the heart, when you start asking people for donations, the shit you get if you don't specify, it's fucking
just like make a wish list page.
People are just going to roll up with like meat thermometers.
Yep.
Yep. You said thermometers. The 490
the ones that like you actually
degrees.
have to. The ones that you actually have to like stick into the meat to get the thermometer, the temperature.
Well, according to this readout, you are medium to medium.
Done?
You're nowhere near done.
Frozen, I think. Oh, in the middle. I'm not sure.
Well,
I mean, go ahead, Sky.
I was just going to say, I was just wanted to express my gratitude because, like, obviously not only just as somebody who cares about my unhoused neighbors and is like hugely grateful to you and anybody else who's out there, like volunteering your time to like make sure they get what they need. You know, I've mentioned this on this topic before on the show, but I think it's worth mentioning again. Like, I'm also grateful just as someone who lives in this community that there are people like you who are taking care of our most kind of disadvantaged and vulnerable citizens, because we, you know, people who, you know, have apartments or houses or people who are in more comfortable situations right now are freaking out as it is, obviously, you know, like, but you know, the goal is in the next few weeks or months, like for us to come outside. But if nobody pays any mind to the most vulnerable folks, like the folks who are living down by the river, then as soon as they come back up from the river, we all go back indoors, you know. And it makes me kind of insane that city leadership just doesn't seem to care about that, because it seems really, really obvious
and
that
county.
Like in the county, and it just seems really obvious to me that in order for like all of us to beat this thing, we all have to do it. In a pandemic, it doesn't matter if like everybody else besides unhoused folks beat it. We lose if unhoused folks don't have a chance to beat it too. And I don't see a lot of action from any kind of leadership about that. And so I don't know. I just want to extend my gratitude and thanks to you and the folks like you, because we're not going to beat this thing without you guys. And you guys are on the front line of something that is really, really vital. And yeah, that's it.
Yeah, I think, Kim, I want to echo what Skylar said. Just like I'm feeling emotional as I'm starting to talk. I just have such deep gratitude for you and for your team, and for the sacrifices that you're making. I know you have a call to help people, your medical students, right? Like, but you never, I'm sure, imagined that this would be your first year of medical school. And I love what you're doing. I think it's truly incredible. I'm so grateful for that. And the other thing is I am a fucking cynic. Like most people I meet, I don't like. And you inspire me to, just, I think there's good people out there, and I love what you're doing, and whatever you need from us, like, holler, because I will retweet, and I will Instagram, and I will Facebook, and I will make phone calls, like, and we have this incredible community of supporters here at Voices, I think, who would stand behind you as well.
That's true. Shannon, I think you're two nodes too of frontline people that like being able to be in contact with each other. It's going to be really powerful.
Yeah,
that support for sure. Yeah, Kim, really appreciate you being here with us today, especially because you're raising up issues that I think a lot of people, even more so than usual, are able to ignore because they're not leaving their houses, right? So even in the way that you might see people who were unhoused before, you can now go weeks, however long we're doing this without seeing anyone because you're not going about your day the way you normally would. So I think just even being able to be on the episode today and raise this issue up is so incredibly important. The work that you're doing is incredibly important, and a reminder that we have to be really vigilant about making sure that the promises that were made are followed through, and that it doesn't rely on medical students in the middle of a really stressful time, not to mention the fact that you're now trying to figure out how to protect your own life while continuing to learn and continuing to take your classes, in different ways, and just all the myriad of adjustments you're making, and then also to be doing this kind of work and to really be, relied upon for essentially primary care, despite that not being, your intention. So thank you. We acknowledge you and recognize you and really want to support you in that.
And I will be the final one to join this pile of love. I think what's really inspiring to me is that folks in their 20s are taking serious fucking leadership roles and going out and saying, no, this needs to happen right now. It's the same way I felt about having Logan on the other day when she was talking about the climate crisis with the Sunrise Movement. And as dark as this shit looks sometimes, and like those of us in our 30s, like we're used to people older than us just like really, really disappointing us. You look at younger folks and like they're fucking doing it, man. And it's so it brings me a lot of hope. So thank you for that, Kim.
I feel like I could even echo on that. I just think in all of our team meetings, something that's come up over and over again is just how working with community members makes us so much more hopeful. There's a woman named Stephanie who goes out every single day and makes like 100 muffins every day, which is just absurd, and feeds like everyone down her street. And so I think like being able to be in kind of that spirit of humanism has been, just like refreshing. I honestly have not been following a lot of the news just because that just depresses me and makes me angry. And then
don't do it. Don't
stay away from it.
You're not missing anything. Somebody will let you know if you do.
Yeah, and then I go out and it's just like,
there's a pandemic, right? That's all you need to know.
Yeah, and people do what they need to survive, but also I think like even with that, they're still kind of like holding a candle out for each other, and that's really impressive.
I think that's a great way to wrap that up. Like it's the humanity, right? The fact that you see someone who needs with a need and you try to fill it, and if you're not able to fill it, you see somebody else trying to fill it, and like to varying degrees, we are succeeding, as best we can, right? I mean, the flip side of that is there are people you're serving out there that like have larger needs medically, and these require systemic changes,
Yeah, and that's, I guess, what we will worry about soon, because what we're doing right now is crisis management, but
Precisely,
just like
Right.
being like right now, some of my classmates are doing PPE fundraisers and just like drives. They're also doing like babysitting, house care for people who are overworked and just completely unsupported by the system. Yeah, and I just think
our medical students should not be in this position.
No.
and the ER docs shouldn't be in this position either. It's just,
And it's just,
it's
it's
not
unconscionable.
sustainable. Yeah.
Everything I've heard about medical school sounds like it's pretty cush, and
Yeah, we just need to add a few more things in, like,
I might go to
life-threatening
medical
illness.
school tonight.
yeah.
You know what? I'm applying for medical school, y'all. It sounds tight.
Try to take some time off and just kind of coast for a little while.
Yeah, I mean, I'm just looking for like any ways that I can just like sit around in a hot tub, and it sounds like med school is the thing.
The way to go.
Yeah, that's the hobby I was gonna pick up.
They're pretty fun crew to hang with, so
Oh, I'm sure, actually.
and super relaxed, super calm all the time. never stressed.
Right.
Yeah.
Just like
what are
hella
you-
chill.
Like, so your last, I don't know if it was like a final or what the iteration of it was on Monday from the semester. What, like, you've got to have something that you're somewhat looking forward to in the next few days, weeks, right?
To be honest, so I'm in the middle of my like cardiovascular pulm. So we had our cardio final, and then in like 3 weeks from now, we're having our pulm finals. So,
Okay.
so I'm really waiting for
Yikes.
after that 3-week hump.
So you're
Just
not out of the
like-
woods yet.
Yeah, to really kick it, but we'll see.
Oh my God. I cannot, like, I'm sitting here just thinking, like, when I was in my 20s.
I've done
This
that,
is-
dude. With between her and Logan, I've been doing that to myself like every
Yeah.
episode, and it's an exercise in futility.
Yeah, okay. I'm going to just stop. I was in AmeriCorps, and that was pretty chill.
That's great. That's service.
That was,
Maybe it's just me. Then.
Oh, yeah, but it was like,
I hate overachievers.
I just feel like we are talking to a young person who was like, I'm in med school and my life is fucking wild. And you know what I'm going to do? I'm going to go ahead and fill a gap that exists because the city and the county can't fucking figure their shit out. So I'm gonna
and
go
the
out.
state.
Yeah, so I'm gonna go out and do that, and I'm gonna do medical school. So I'm
Yeah.
never gonna sleep, and I'm never gonna eat, and I'm never gonna rest.
Yeah.
And she's just like here, and she's like, what? I am
Great.
in awe. I bow at your feet and crack another White Claw.
Whoa.
I hope we've made you sufficiently
Yeah.
uncomfortable with praise.
Like, never will I hang out with the old people again.
Right?
Yeah, I was just gonna
So
say thanks for
weird.
not coming on the show and telling us how old we are, like the last time we had a 20-something.
Oh, man, yeah.
Right.
Logan, let us have it.
Logan,
Logan,
she
Logan, we love you.
drop kicked us.
Logan, you were just being honest. It's okay. Auntie believes you.
Well, it's weird, like,
Auntie supports you. It's fine.
in your mid 30s, when we first started recording, we had some older listeners, boomers, if you will,
There we
saying
go.
that they were surprised by how young we were when they saw us finally on screen. So, I mean, we're in that space where we are young to them and old to everyone else.
Yeah, we're young to
is
old
correct.
people and old to young people. That's not like the
Correct.
wildest phenomenon.
Yeah.
Yeah.
I mean, it's just weird for me because, like,
Dang, sick
normally
burns,
people-
Tyler.
I don't know. Normally people don't even like think I'm in my 30s. So I'm finally feeling it.
I mean,
now.
I don't think it's because people are like, dang, Dave, your skincare routine isn't going so well. I think it's more so because you're being honest about your age, and people are like, dang, you old. That's
No, yeah, that's definitely what's happening. Yeah.
It's not a referendum.
Everyone
on,
keeps
how
sharing
quickly
my
you're
age with
aging.
people, and now I feel old. Yeah.
To
Well,
offer
I
my
get-
two cents,
age to
I think
stop.
it's because
You have to, like,
you're a
be
white
really
man
big
who
about that
hasn't lost
age.
most of his hair. So
Yeah, that's true. That could be it.
That is
And he
it.
doesn't have the grays either. See, my
No.
grays betray
Yeah.
me. I have to wear a hat or I look like I'm 90 years old.
I'm dying for some grays. I got just like the John Mulaney look. I'm always gonna look a little like I look like the kid that's just like burning the candle at both ends.
God, we have really
That's my
covered
favorite jokes of his.
so much tonight. Where, from protests to radical kids to all of the co-hosts feeling old.
Yeah.
Look at
Great
Well,
show.
it's
Full
funny because
show.
in the intro, what I wanted to do with the direction I thought we were going to go was
No.
hey, you can play Frisbee golf now. And I was like, that's me defeating the county. I won that fight. But no, we went down a very dark path.
It's dark times.
We
I think
are
we have
fucked
to accept
up
it's going to
people.
happen sometimes. We are.
We
I
are dark
read the
people.
news. I'm not one of these people who doesn't read the news. I wish I could stop, but
Yeah, I mean,
tough.
let's be honest about the vibe of Voices, and it's like pretty angry, and then Flo came on, and she was like, she brought the
And
Flo,
Flo.
and Flo, she brought the optimism. It's not surprising to me that the intro went the way it went.
I don't know. I think there's plenty to be cautiously optimistic about. In as much as if you look at the current numbers and again, because we don't have the testing, we don't really know, but it appears that the death rate has dropped really low in Sacramento County, and it looks like we're doing the job that we should be doing as Sacramento County residents, and I think that's something to celebrate at the very least.
Absolutely.
Yeah,
So-
totally.
Absolutely.
There's a couple things to be happy about, and not happy,
Yeah.
but yeah.
Well, Dave, I don't mean to bring down the mood of the whole podcast now that we're all pepped up and happy and optimistic, but I have some personal news that I wanted to share with the show.
Oh no.
I was laid off. I'm unemployed because
Oh
of
my God.
COVID-19. But that's not the bad part. That part's been okay. The bad part is that after now weeks and weeks of spending all my free time reading all this great Voices content, I mean, from these deep dives into to issues that affect unhoused folks, to conspiracy theories that are engaging and interesting to hear about, I've come to the end of what I know, what I can find of Voices content. So my question to you, I got to have more Voices content, man, but where do I go to get it? I need you to help me out. You're my guy. You're my Voices guy.
I have very little to give, but the one thing I do have is Voices content. So you've come to the right place.
I knew I was asking the right guy.
Like I said last episode, it was our 3-year anniversary, and our current iteration is a little different from how we currently are, but started. But I think it's really fun to see that we're going to be starting up our community Voices up a little bit, those essays, which is what Voices, that was the spirit of Voices at the beginning. But anyway, we are at voicesrivercity.com. your essay, Skylar, will be coming up this weekend. I've got another great community member essay coming up early next week. And I mentioned this one again too, but I'm actually doing it this weekend. The Follow the Monies project, right? So I'm going to be the final 2 city council races. I'll be throwing down those spreadsheets, telling you where everybody works and what industry they're in, who's a donor to the contributor to these city council races, and you get to decide for yourself what that says about the person running for office.
Hell yeah. Spoiler alert, it doesn't say great things about them.
Often no.
Yeah. Usually has negative implications.
Yeah. Back when I kind of started it because of Steve Hansen, and it said he's good friends with developers. We knew that though. But so I'm doing that. Anyway, we are on social media at Voices River City. We're on Facebook, Voices River City, Twitter at Voices River City. I mean, where else are we? Oh, we're on Patreon. If you don't have money, don't fucking give us anything. Even if we ever do a paywall thing, like for patrons only, if you don't have money, just say, hey, Kempa, can you send me the link to that? And I will give it to you. But if you want, you can go as low as $5 a month as a patron, which is a beer at the bar that you're not going to right now. And we love all the patrons we have. We've reached some really big milestones this month. We went over 1,000 downloads in a month. We had over 400 views on YouTube, which is our first month of YouTube. And it's cool to see us growing, and we're excited to keep doing more. So as long as you're willing to like look at our weird hair and stuff as we're in quarantine.
I would like to add on to that, like whether you can donate or not, which if you can, obviously we're hugely appreciative. But cruise to the Apple Podcasts app, rate us at 5 stars, leave us a review. And barring that, if you like the show, tell your neighbor or family members or friends or whatever about it. If you hate the show, tell your fucking enemies to listen to this awful show.
That's great advice.
That is a great call to
Tell
action.
your enemies.
Yeah.
So they can come and listen to us.
And yeah, so each one of us is on Twitter. I am at Kempa.
I am Guillotine for you. That's Guillotine, the number 4 YOU.
The letter 4.
The letter 4. You're going to make me say it. One of these days I'm going to do it.
I can't wait. I love to think about it. I'm Shan N.D. Stevens.
And I'm Flojaune at FLOJAUNE.
Now, Kim, if you do not like to have your personal social media shared, that is totally fine. But if you do, let us know. And otherwise, remind folks how they can connect with Encampment Med Team.
Encampment Med Team has an Instagram and a website. So the website is don't know how many W's I said, encampmentmedteam.org. And you can follow my Twitter, but mostly it's just like meme content and cute animals.
That's most of Twitter. I think.
It's very occasional, useful content. Very, very occasional. And that's Zen Kim Lau, and that's ZHEN Kim Lau.
Great. I think that's our show.
Love it.
Wait, where are we out? Where are we out with Be Brave, Bold Robot this week? Do we like them or do we hate them?
Like them, hate them?
No, we're cool. It's fine.
I'm not cool, Dean. You watch yourself, man. You see me on the street, you go the other way.
Yeah. So thank you.
But we'll check in next week.
Yeah. Thank you for your music, but also fuck you.
Yeah.
If you see me on the street, go the other way.
Stay 6 feet away from me, Dean.
Yeah.
Don't you fucking breathe on us, Dean.
Damn it.
All right. Well, everybody stay safe, stay sane, stay healthy, stay away, stay home.
All right. Bye.
Stay home.
Bye. Stay home.
Bye.
Bye, everybody.